guys, it's me, and I am so happy to be back to do a update on my post-op surgery for arachnoid cyst. As you can tell, I'm in a much better spirit. I am doing my 4-week post-op. Tomorrow will be Friday, my 4-week post-op. I had my surgery on May 25th, and yeah, so let's see. I can't even, honestly, I have to tell you guys, I can't even remember if I did a 2-week video because I was on so many drugs and pain meds to kind of help me cope with this pain. So I'm just going to give you a short little video. I'm gonna stand up here in a minute, but yeah, I'm sitting down. I'm in a chair right now, and as you see, I still have my cast on. For those who didn't watch the other videos, I had spinal arachnoid cyst that was in my, I believe my T2s, and went all the way down to my L12s, or it was the other way around, L12, T2, I can't remember the other way around. It was 4.5 inches. And it was pretty large, and it was compressing on my nerves. I was having urine issues where I was having a hard time controlling and holding the urine. I was having major back pains. I mean, major back pains, where now that I feel better, you guys, I cannot even tell you how much pain I was in prior to surgery. Like, it's unbelievable. Like, I am completely a new person. I'm so freaking happy. That's all I can say. My pain when I would stand, I probably could stand maybe for 1 minute, and I was starting to have really bad pain. It was right up under my shoulder blade in the back, and it would radiate down into my spine, to my buttocks, to my legs, my top of my shoulders. Everything was tight. I would lay my head against the pillow like this, and I would have like nerve endings tapping. It was really, really bad. I had a lot of dizzy spells and nauseousness and numbness and symptom after symptom after symptom, fatigue. And now I did a preliminary video prior to surgery, but now I really can tell you some of those other things that I didn't even think was associated with this surgery. So clearly, neuralgia was one of them. Like, my hands would go numb, they would tingle. My toes would go numb, they would tingle. My feet even hurt. Actually, I had terrible feet pain. Like, I would stand up and my feet, the balls of my feet underneath my toes and on the heel was in so much pain that I started to wear like old people's shoes, honestly. I had bought myself, like, Sperry's aren't necessarily old people's shoes, but I had bought myself some Sperry's, and everything was low, and I'm a perfectionist. I'm a heel wearer. Like, I'm a straight girly girl. So for me to put on a pair of Sperry's was like, you gotta be kidding me. But anyway, so I had resorted to wearing all low top shoes. And it wasn't just like your regular low top shoes. Like, I wasn't wearing like cute little sandals, even though I was, but I was in pain when I was wearing them. Like, I needed orthopedic shoes. That's how bad it was. So that's one of the things that you may not relate to it, and I don't even see where doctors necessarily relate it, but I know that now that I'm feeling better, yeah, it was definitely related to it. My butt, like, I had a butt of an 80-year-old. Like, I literally would stand up for a few minutes and I would have like spasms all the way down to mid back to the butt, and they hurt so bad. Like, my butt muscles, like, I float my boat just a little bit, but I had what I would consider a nice looking bottom. And it started to like go downhill, but it was going downhill because I wasn't standing. I wasn't walking. I wasn't doing anything more than like a minute or two. So of course your muscles are going to start to deteriorate and decline. And that's what was happening to my body. Like I said, the nauseousness, I would get nauseous so bad. Like, I thought, oh, it's time. I haven't eaten in a while. That's why I'm getting nauseous. Let me go eat. And I thought that was the reason. No, because now I can go for a long time without eating, half the day, and I'm not getting nauseous. it was all associated with the spinal arachnoid cyst. Let's see what else. I went over neuralgia, went over my buttocks, went over my feet, my head. I kept headaches. When I say headaches, like, okay, so I have really bad allergic asthma. I mean, extremely really bad allergic asthma. So I assumed that the headaches that I was having was kind of coming from like hay fever, allergic asthma, sinuses, grass. I'm allergic to everything outside. So I was like, this has got to be the reason I'm having these headaches. So I was like popping allergy medicine, sinus medicine, headache medicine, anything I could think of. Now, literally, okay, so there's a thing. I'll go over some of the symptoms, the after surgery symptoms for a month, but headaches for that reason, gone. None. Not that type of headache. There's another type of headache that I'll kind of go over, but no, my sinuses are like clear as they could be. So I don't care what the doctors say. If you're having these headaches and you're thinking it's sinuses and everything else, that's something you just may want to consider. I was even having eye pressure. Like my eyes would pulsate, literally. The vessels in the eyes would pulsate. And I don't know if people could see them because I never was like, hey, look at my eyes. Can you see if they're pulsating? But I definitely could feel it. When I would lay my head down on the pillow, the pressure was through the back of my neck, all the way through the front of my head, through my nose, through my sinuses, in my cheekbones, in the sides of my ears. I was overwhelmed. Like when I tell you I am such a happier person. Just I'm sorry if I sound lame or just like ridiculous or just unreal, but I think I'm so mentally more sound. I am happy. So enough about me being happy and all the things, because you're not here to hear how happy I am, but I'm sure that will actually be refreshing for you if you're going to have this surgery. So I am, like I said, I'm 1 month post-op. I actually ended up going back into the hospital a week and a half ago because I had a spasm relapse. These spasms were worse than what I was having before surgery. It was the most excruciating pain that I think I've ever experienced. So the spasms only came at 3 times. They would come when I would lay down, and they would come when I would stand up, and they would come like mid-walk. But they were so bad. They radiated from the abdominal area around the waist to the back on my left side. Originally, they were actually left and right, but the right side stopped and then the left side started to get worse. I don't know if it was worse because, like I said, I have this broken arm on my right side. So maybe I overused the left side, and maybe that's why they just kind of stayed on that side. I really haven't. I'm not a doctor. I don't know. I'm just here to give you what happened. So they were so bad that one morning I woke up. I tried to get out of the bed and I fell. Now I have a broken arm. I have a contused hip. I was already injured from falling the week before surgery. So when I fell, it was pretty bad. It was quite unbearable, actually. So I ended up going back to the ER, and they kept me there for 4 days. They put me on prednisone and Vicodin and nerve medicine and everything. By the way, take those stool samples. I know I said that in another video. Take your stool samples, because if you think you're in pain, you really are in pain, but you're definitely going to find out that you're really in pain when you can't use the bathroom and you're already having you've had spine surgery. You definitely don't want to deal with that. So yeah, take your stool samplers. Not your stool samples, but take your stool medication. I think I was telling you about my second trip back to the hospital. So I had my second trip back to the hospital. I was in quite a bit of pain. I was not really walking that well because of the pain. However, 2 weeks before that, I was feeling great. I mean, I was walking a little bit better. Wasn't in as much pain, but I had a relapse, and I probably had a relapse maybe because I was trying to do a little too much. Like I was lifting pillows. Be obedient. If your doctor says don't lift anything over 3 pounds, no lifting. They have this thing mentioned in my previous videos called BLT. No bending, no lifting, no twisting. Be obedient. Trust me, because I was not obedient, and therefore I ended up back in the hospital. If you don't want to do that, be obedient. So I was even washing clothes. I had my like little reacher or whatever, and inside my little reacher I would pick up like a couple clothes and put it in the washer. I was walking around even though I could barely get off the bed myself, but I was determined that I was going to be Miss Independent. Okay, let somebody help you. It is not worth it. That return trip to the hospital was worse than when I got out the first time. The pain that I was experiencing was excruciating. So what I was dealing with was the surgery pain, the wound pain, these spasms, and these headaches. So what would happen is these spasms would start off in my bottom spine area around the waist, and they would go up the back and through the head. And through the head, I would get an instant migraine, instant shutdown, close eyes, can't look at anything, can't hear anything, can't see anything. And with it was also nauseousness. That experience was traumatic to me. And so when I came out this time, I set my behind down. Yes, I did. I let people do for me. I'm an extremely independent person, and that was very hard to do that. But just let them do for you. It's definitely not worth it. The experience that I had, it was traumatic. Like I said in one of my other videos, I've had a baby without a tear. This was a whole nother level of pain that I was experiencing. So just be obedient, okay? Take your medicine. I was on second round was the Vicodin. I've been on 3 pain meds. I think Percocet, Vicodin, and Tylenol codeine. Tylenol codeine was what I was on when I came out of the hospital the first time. That is a little mild, so it's not so bad. And then the second one, the last one was the Vicodin, which is better. 1 month out, I'm barely on any pain medicine. Honestly, I took I bite it into 3s. I took a third this morning because my body kind of set in. I had slept on the couch like a couple days in a row. No, don't do that. Because your spine drops in the couch and it's not enough to support the body. You really need something that's firm. So whatever you do, like have your bedroom downstairs, and have something that's firm. It's pretty important because not only you have to remember that your spine is trying to reattach itself and to have those nerves repair themselves. And if you're sleeping at a funky angle, your back's going to heal kind of funky, and you don't want that. So having a firm mattress is pretty important. Having the pillows to support your back, depending on what your body shape is, you may have to put pillows up under your lower back or whatever it is. Do it, whatever it takes. I am not ready to go back to work yet. I don't think the doctor is even considering it. Well, I'm ready. I don't think the doctor's considering it. So I have an appointment with him the first week of July, and we will see what he says. Maybe I can go back part-time. I don't know. But I am walking, so I'm going to get up so you can at least see a portion that I can walk just fine. I'm a little bent over, honestly. Just a little bent over in my back area. I may like have this funky little bent over walk like that where you can see the curve in my back versus a straight up a walk. So, but I can walk normal as you see. So that's pretty important. What else? Sorry, a little video. But what else? I don't have any headaches that are associated with migraines. What I do have is I do get headaches, but they only come when I'm sitting down straight up, when it's associated with the pressure on my spine. So when I went to the doctor, I talked to my doctor, who's an excellent surgeon. Love him. Shout out to Dr. Nair, Manny Nair, MedStar. He did my surgery at Georgetown Hospital, and he is awesome. He rocks. So yeah, hey, Dr. Nair, how are you? Waving with no arm, but yeah. So he's awesome. He did an excellent job. But the advice that he gave me was caffeine. He was like, your body is used to having a certain amount of pressure. Your head is used to having a certain amount of pressure on it. And once you've had the surgery, the pressure was released. And so your body is basically having a shock. So what I did was got some Excedrin migraine headache medicine. I don't suggest it from everybody. Actually, I don't even suggest it for myself because I was wired. I was like, woo, yeah. But anyway, that was lame. But I was extremely wired. My heart was racing. So I am still taking Excedrin migraine, but I cut the dosage in half. So I'm only taking a half a pill because I don't drink caffeine. The caffeine and me don't get along because I'm already naturally hyper. You hear how fast I talk. So, yeah, you may not need it. I mean, each his own, whatever. But for me, I'd rather not do the caffeine. But he was exactly right. Once I did the medicine, took the medicine, my headache was gone. It took the pressure off. I also tried a shot of espresso. Just plain, only because I have a lot of allergic asthma, so I don't drink dairy and things like that. I did it plain. That helped. Not as good as the half of Excedrin, but it definitely did work. So one of the few surgery post-op some things that I have going on is slight headaches, slight pain upon initial getting up and sitting down, but it's really, really slight. So right now I kind of just take my time getting up, take my time getting down. I walk with a cane when I'm out, but as you can see, I actually can walk without it in the house. So when I'm out, it's for extra precaution to make sure I don't slip or fall. And, you know, my husband is worry wart, so he won't let me out the house without my crutch or my cane. But mind you, I'm actually on my crutch and my cane because I fell prior to surgery, not because of surgery. So I have kind of have like this dual thing. So I need the crutch, need the cane, whatever. They're gonna be out of my life soon. So excited about that too. Well, this video is kind of long. Don't want to bore you guys, but I just want to say thank you to my viewers. Thank you to everybody who's taken the time to watch this video. I probably won't do another one probably for at least 3 months because I'm really at my, I think, best point for being 1 month post-op. And I probably don't have to do anything. I'm probably not going to have any other symptoms that's going to change other than, you know, me going back to work, me being maybe fully active. So I'll probably do a 3 month, a 6 month. Do you have any questions? Leave a comment below. Thanks for listening, and don't be afraid of surgery. I'm excited. Bye. Thank you.